Good day to the viewing and the listening public. This is the COVID-19 update for Tuesday, April 20. I am Godfrey Brooms. And with me is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's a pleasure always having you. We'll start today with the COVID-19 cases in Guyana. With over 11,000 cases confirmed thus far and a notable increase in the cases in Region 4, can you say which areas are being currently monitored at the moment?
Well, we have seen an increase in cases in Region 4, Region 3. We have also, in Region 7, we have a number of cases as well. So we continue to monitor these areas. In Region 4 specifically, we have seen an upsurge in cases around Diamond Eccles area. On the East Coast, we have seen cases in the Lusignan, Success area. So there are pockets where we are seeing more cases, but generally when we look across, say, the East Coast or Georgetown or the East Bank, almost every village there are 1 or 2 cases. Similarly in Region 3, at Tushin, we have seen more cases. But again, in different villages across Region 3, there are 1 or 2 cases that exist. We have to keep monitoring. We have a number of persons in home isolation, and we have a number of persons in institutional isolation, and that exercise continues. But again, it comes back to people doing the right public health measures, and that is wearing their mask, making sure that they keep the distancing. And once you do that, at least you're protecting yourself, and by extension, you're protecting your family when you get back home. So once you're out in the public, you have to take these precautions because you don't know who you might be sitting next to or standing next to, whether they have the virus or not.
Minister, can you briefly give us an update on what's happening at the Ocean View facility and other hospitals with respect to hospitalization of persons affected by COVID-19?
So right now we have 71 patients who are in hospital. We have 15 patients at the West Demerara Hospital. We have 5 at the New Amsterdam Hospital, and the others are in the Ocean View facility. We had, as of yesterday, we had 5 patients at Upper Demerara, Linden, but they have now been discharged, so they're back home. In the Ocean View facility, we have persons who are there. Most of them we are observing, and they might require some support. But the majority that are there are doing fairly well. We have, however, a smaller percentage of persons, about 13 or so persons, who are in the ICU, and they require assistance in terms of breathing and so forth. And they have been getting that assistance. So we continue to monitor and work with these patients. We have a team of doctors who are constantly working with them to make sure that they get better.
Thanks, Minister. The COVID curb operations continue to make headline in the newspaper and on social media, of course. I know late last year the government and by extension the task force was heavily criticized for the lack of enforcement. But now we've seen a drastic change. To this end, are you satisfied with your work?
As I've said before, you know, there's always room for improvement. And while the COVID curb would be working to do more enforcement, all of this can be avoided if people do the right thing. And I think that's what we are trying to appeal to people to do, because we are all in this together. And if you're going to break the rules, then you're not only endangering yourself, but you're endangering others. The task force would continue to do its work. They have been working with businesses, looking at the businesses that have been breaching the COVID orders, and they have started to look at individuals too who are in the public and are not wearing their mask and things like that. So this is going to continue. Some people have been clamoring for us to be more stringent, and the task force, we have heard those calls, and they're now making sure that they put stronger measures in place.
Minister, as of today, or rather yesterday, how many persons have been vaccinated? And apart from Region 9, what is the percentage of healthcare workers vaccinated against the COVID-19?
As of yesterday, we have 92,410 persons who have been vaccinated, and it's distributed across the region. We have not, in recent times, been tracking now the healthcare workers who have been vaccinated. We had done so earlier when we had a limited amount of vaccines. But now that vaccines are available to every adult in Guyana, we expect that people would come forward and get their vaccination. So this is a campaign that, we are continuing on a daily basis. The response has been good over the last couple of days. On average, we're getting about 6,000 people coming out. We are hoping that we can improve that and get more people coming out and get more people vaccinated faster. There have been some queries or some speculation about whether persons who received their first dose would be able to get their second dose, and we want to assure everyone that we have kept the second dose for them. So if you receive as your first dose an AstraZeneca vaccine, we have your second dose for you. If you receive a Sinopharm vaccine, we have your second dose for you, because the allotment that we got, we divide it in two, and we kept half of it in storage while we give the other half as your first dose. So we have enough vaccines, and everyone can be assured that they will get their second dose.
Minister, is it true if someone takes the Sputnik V vaccine, he or she cannot use alcohol until 2 months later?
That's something that I recently saw an article that was suggesting that. There is no scientific rationale why people should abstain for that prolonged period. However, like with all vaccines, we would prefer people not to drink before they come for a vaccine, and immediately after to abstain. And the reason being is that if we are going to observe to see whether or not someone has side effects from the vaccine, then we need that person to be sober. So we haven't seen in any of the scientific literature that the vaccine interacts in any adverse way with alcohol. But out of an abundance of precaution, I would urge that people who are coming for the vaccine, at least over the 24 hours before and 24 hours after, remain sober, and so that we can monitor and make sure that there is no adverse reaction.
Thanks, Minister. If a person has an underlying medical condition, can that individual still take a COVID-19 vaccine?
Well, yes, it depends on the condition. One of the things that we keep saying to people is that persons with comorbidities, or as you put it, underlying medical conditions, are the ones who are most at risk. So we know that persons with diabetes, hypertension, cardiovascular diseases, kidney diseases, and so forth, they are all at a higher risk for COVID-19. And therefore, these vaccines would help to prevent the severe form of the disease, and that's why they should come out and get the vaccine. There, however, may be a few conditions that if people are uncertain, they should consult with their physicians who can advise them whether or not they should take the vaccine.
Minister, who should not take the vaccine?
Persons below the age of 18.
And that's it?
Yes, for now. But there are studies right now that are being done to see whether or not the age can be lowered. In the case of the Pfizer vaccine, which we don't have, that they are now conducting trials for persons 16 years to 12 years of age, and they are now asking for emergency use authorization to give to those children. They're also working on looking at younger age groups and to see whether or not they can give the vaccine at that younger age group. For most of the other vaccines, there are going to be trials, but those trials, we haven't seen those results as yet. So as of now, if you're not an adult, then you shouldn't take the vaccine because we just don't have the clinical data on the vaccine.
Thanks, Minister. Some of the side effects of taking the vaccine are tiredness and the tenderness of the arm, etc. Can someone take anti-fever or anti-inflammatory medication following the vaccine?
Following the vaccine, if you develop these signs and symptoms, that's fine. You can take medication to prevent the fever or the pain. There are, however, some people who wanted to take the tablets, let's say a paracetamol or something, before getting the vaccine. Now, that's not advisable for the simple reason because you don't know how your body is going to react. Some people wouldn't have any reaction at all. Others might develop a little fever. Others might develop a little pain. So it's preferable to take the vaccine first, and if you develop any signs or symptoms, then you can use the paracetamol.
Minister, if you take the medication immediately after, would doing so decrease the level of immunity the vaccine provides?
Absolutely not. The mechanisms of how maybe a paracetamol works and how these vaccines work, they're two different mechanisms. Vaccines work by stimulating the immune system so that the body can produce antibodies to fight off this antigen that was inserted into the body. So that's a totally different mechanism. Paracetamol would help to reduce the pain, and that uses a different mechanism. So the two things are not in conflict.
Thank you very much, Minister. This has been the COVID-19 update with the Minister of Health, the Honorable Dr. Frank Anthony. For more information, you can visit our website at dpi.gov.gy and our social media platforms. Godfrey Brooms saying goodbye for now.